So I think it's really sad at the moment that the whole focus on health is around weight loss, and that's been really detrimental to a lot of the people that we see of all shapes and sizes. So there's this real idea that being healthy means not eating any bad foods and really focusing on exercising as much as you can and losing as much weight. But even if that was the answer for physical health, it's neglecting the social and emotional components of health as well. So we try and get people to have a broader perspective of what health entails. And we know things like loneliness is a bigger predictor of some chronic diseases than what smoking is. So trying to help people understand that it's one thing to be sitting at home eating salads all the time. Maybe that's okay for you physically, but you're missing out on some of the social and emotional connections that come from going and eating out and connecting with people in a social environment. So I think our practice is really trying to broaden people's perspective of what health is about, and I suppose a more broadened perspective of health as well, in that it's not just less weight equals more health. Like, it's not that simplistic, and that's not really helpful for anyone. Trying to help people understand that they can be healthy at any size, and that a part of health is the social and emotional and feeling happy and content about themselves. I'm thinking of a client at the moment who was highly distressed. She probably wasn't in a great place mentally, and probably her mental health and her ability to improve her social relationships and to regulate her distress was her priority. However, some of the people in her treatment team, not here, raised with her that she had a fatty liver and that she really needed to be focused on losing weight. And that was just too much stress on top of somebody who's already quite emotionally distressed. So we would kind of look at it as, even if the fatty liver is a problem, we know there's other ways to go about it without telling someone they need to lose weight, first and foremost. But also it might just be that that's just not where she's at the moment. Let's help her kind of feel a bit more in control of her life, a bit more empowered, a bit more stable and happy, and then we can move on to progressing some of the health concerns for her. So yeah, I think that there can be all of these things going on for a person, but it's collaborating with the person and getting a sense of where that person needs us to start.